Welcome to Home Health with Speedoc, a webinar series which aims at making healthcare information easy to understand and accessible to all. We start the session on matters of the heart, from controlling calories to combating COVID-19. And we're very pleased to have with us Dr. Michael Macdonald, Senior Consultant Cardiologist from the Harley Street Heart and Vascular Center. Welcome.
Yeah, nice to be here. Thanks for inviting me.
And for all our guests, I'm your host, Aisha Kohli. For those of you who may not know Speedoc, just a little introduction. Speedoc provides medical care at your preferred location 24/7. So from video consultations, home doctor visits, nursing visits, medicine delivery, specialist consultations, you can do it all from the comfort of your home, all through our app. So find us on the App Store and do download us. To make the webinar experience a little user-friendly for everyone, here are some guidelines. So please keep yourself on mute during the webinar so there are no audio distractions. Please send in any questions that you may have through the Q&A function while the webinar is going on. Questions will be answered during the Q&A segment at the end. And again, another little introduction. So Dr. Michael Macdonald, like I said, is from the Harley Street Heart and Vascular Center. He has a special interest in heart failure, diabetes, preventative cardiology, and we're going to really pick his brains and make things very easy to understand for all our panelists here, our audience here. The perspective is to really make, to bring to fore issues on heart health, what's going on and how people can look after themselves. So the agenda is going to be a bit like this. We're going to start with the kind of symptoms that are critical to notice and to report to the doctor immediately. How COVID-19 affects heart disease patients, linking obesity, diabetes, and the heart, nutrition to keep our heart healthy amidst COVID-19. Very interesting topic. Does gender make a difference in matters of the heart? And how can Speedoc help you in taking care of your heart health? And finally, some Q&A where we open up the floor to questions from our audience. So let's just set the context for cardiovascular disease. It is the leading cause of death globally and projected to remain so. Nearly 1 out of 3 deaths in Singapore is due to heart disease or stroke. And global media reports suggest people are avoiding hospitals currently and not reporting signs of heart disease. So Dr. Macdonald, is this a concern?
Okay, so yeah, this is a big concern, and it's not just in Singapore, it's across the world. So there was a recent report from the UK where I think there was a 60% drop in people attending hospitals. And it's not just for people, you know, they're not attending hospitals, they haven't got symptoms of colds and things like that, but it's actually, there's been a drop in heart attacks and strokes across the world. Heart attacks and strokes, the way they happen is they happen out of the blue. They're caused by a plaque in the artery rupturing or getting inflamed and causing a blockage in a vessel. And there really should be no reason why the rate of heart attacks and strokes should fall across the world like this. So what it suggests is that people are actually probably just not reporting the symptoms that they're having. They're not reporting the kind of weakness they might associate it with stroke or difficulties in speech, and they're not reporting chest pain. So this is a big concern, because if you delay getting things seen to, like heart attacks and strokes, then number one, you are increasing your risk of death, and number two, you're not giving yourself the chance to have these conditions treated promptly when actually things can be prevented in the future. So I think we're storing up a lot of problems for the future with this.
So let's get to the basics, right? The symptoms that people may be ignoring. What are the symptoms that indicate that one may be having a heart attack?
Okay, so first of all, the kind of classic symptoms that people always talk about when they have heart attacks is chest pains. It's usually a sudden onset of a chest pain or a chest tightness or a breathlessness. And often it will be associated with things like sweating or a feeling of just feeling incredibly unwell. But what I will say is that it's really very variable. You know, the symptoms that people can get can go from being very, very severe, so clutching the chest, to actually being incredibly mild and being kind of mild chest pain or breathlessness. So the advice we always give patients is if you have any concerns, see a doctor, get your symptoms assessed, get an ECG and get a blood test done. Because often, you know, if you do have symptoms and you don't get assessed, you might miss something that's important. And it is possible that you could miss having a heart attack.
Yeah, I was coming to that. Is it really true that people don't report heart attacks? I mean, how does that even happen?
Yeah, it does, because people there's a proportion of people that really don't get any symptoms at all. There's a proportion of people that get symptoms and think there's something else. And one of the classics is they maybe think of it as being a little bit of indigestion one day, some kind of breathlessness, and they think, oh, I'll just wait and see what happens. And eventually it'll go away maybe 2 or 3 days later. But actually what they've experienced are, you know, milder symptoms of actually having a heart attack. And we'll sometimes pick these up when we see the patients weeks or months or years later, and we'll say, look, you've actually had a heart attack in the past at some point. So if you have got any of these symptoms with any concerns, don't delay. The important thing when it comes to heart attacks is actually getting it dealt with early, because when it's dealt with early, we can actually prevent death of the heart muscle, and we can reduce your chances of things like death and heart failure in the future.
So is there some, you know, for people who think that they're fine, that there's really nothing wrong with them, is there a profile maybe if I may fit into something that I should look out for heart disease? Or is there a certain age where I might get it? What are some of the lookouts?
So there are risk factors for heart disease, and there are certain groups of people that are higher risk than others. But anyone can have a heart attack. So even if you don't fall into these groups, you do still have a small risk, although your risk is probably less than if you fit into these groups. So the drivers of cardiac risk are advancing age. So the older you get, the higher your risk. If you're a smoker, you're at higher risk. If you have diabetes or high blood pressure or high cholesterol, it puts you at higher risk. If you've had any previous heart problems or any previous heart attacks and things, you're at much higher risk of having a future heart attack. And men are at slightly higher risk when they're younger than women are, but women tend to catch up as they get older.
So what are these tests that I might take? Suppose I'm hale and hearty really at the moment and no issues. Are there some preemptive tests one can take as one ages, or, you know, what would you recommend? Yeah,
definitely. So everyone over the age of 40, well, everyone should have their blood pressure checked opportunistically when they can. Okay, that's the first thing. Because you can pick up high blood pressure is a driver of heart attacks and strokes, and it's completely asymptomatic. And the only way you really can get it picked up is if you get your blood pressure checked. So that's the first thing. As you get older, you know, once you get past the age of 40, you should be getting proactive health screening done as well. So that is getting your blood glucose checked to make sure you've not got diabetes. It's getting your blood cholesterol checked to make sure you've not got high lipids. If you do, they might need treatment. And, you know, if you have signs of, like, say, chest pain or any breathlessness, and you do have concerns, then you can see your doctor and get an ECG test done as well. That gives us a lot of information as to what's happening with the heart.
So is there, I mean, this may sound like a very simple question. Suppose I do feel chest pain or breathlessness. Do I report it immediately? Do I report it in a few hours, the next day? Like, what would you suggest?
So I would never tell a patient not to get seen if they've got concerns. And if it is a heart attack, well, the saying that we've got as cardiologists is that time is myocardium. So myocardium is the heart muscle. And the longer you delay picking up a heart attack, the more damage is done to the heart muscle. So if you are having a heart attack, then you need to get it dealt with promptly and quickly. Now, a lot of chest pains perhaps won't be heart attacks, they'll just be kind of muscle pains, but it's difficult to determine what pains are what unless you get assessed. So if you do have any concerns, I would always advise people to see a doctor and see them relatively quickly. And if they feel really unwell, then just call an ambulance.
Okay, thank you for that. So just to summarize for all our viewers, if there's any symptoms, which is breathlessness, chest pain, discomfort, even if it's minor, when in doubt, call a doctor. Don't wait, right? Okay,
Absolutely.
so in the context of the times we are living in, COVID-19, everybody is very scared of underlying comorbidities. So would I be more vulnerable to COVID-19 if I had a heart condition?
Yeah, so COVID and heart disease has been a big thing in the media. And I think, first of all, we all have the same risk of getting COVID. We all have the same risk of getting this virus. But if you have a heart condition, you're more likely to have severe symptoms. So everyone needs to take the same precautions about washing hands and isolating themselves. If you have a heart condition and you get COVID, you will be slightly more at risk of developing severe conditions and perhaps dying. And it's largely something that's driven by age. And what we see is that the older people are, the more risk they've got of death. And similarly, when people get older, they also have more heart conditions. So the most vulnerable people are the elderly and those with a pre-existing condition. You're not more likely to get it if you have got a heart condition.
So I understand it's not more likely, but if you do have a heart condition, is there some watch outs? I mean, if my family has somebody in my family has a heart condition, what should I do? Yeah,
so practical advice. So the government is trying to stop our most vulnerable segments of society getting this condition because it's going to affect them more. And it's the same advice, it is isolation. So if you've got elderly members of the family, you shouldn't be visiting them. You should be trying to make sure that they're not coming into contact with other people, because that's how they're going to get the condition. They're going to get the virus if they're exposed to people that have the virus. So they essentially have to be isolated, and you need to take standard precautions with face masks, washing hands. And if you yourself do have a heart condition, the important things are that you continue to take your medicine. You make sure your heart condition is stable, because if you do get the COVID virus and your condition is already unstable, you're perhaps going to be at more risk of problems if you get with the virus. So if you already have high blood pressure or have had a heart attack in the past, then you need to be taking the advice of your cardiologist, taking the medications you've been prescribed, and making sure you're stable by chatting to your doctor, which can be done by teleconference these days. You don't actually have to go in and see them.
So I'm sure that people have a regular schedule of checkups. Are you suggesting that they check in with their doctors even more?
Well, no, but so let's just say you have high blood pressure. You can check your own blood pressure at home. If you had, abnormally high values, then you can obviously consult your doctor, and you can actually do that with teleconsult these days. You don't have to go in and see them. If you have any concerns that your condition is unstable, you're getting more breathless, let's say you've got heart failure, you're finding that you've got swelling of the ankles, or you're unstable, then you should be consulting your physician. You should be seeing them to get advice on how to stabilize things.
So in summary, just to be maybe more self-aware of your symptoms, especially during these times, and if again in doubt, call your doctor.
Yeah, I mean, don't avoid healthcare services altogether. We're doctors, we're here to speak to you and help you, and we can do it via teleconsult these days if necessary, if you're worried about coming into hospitals.
Well, thank you for that. Moving on to, I'm just trying to. To another big challenge, obesity. It's a global challenge, and the World Obesity Federation says 2.7 billion people may be obese over the next 5 years. Those are massive numbers. Let's start with a very simple thing. What is the medical definition of obesity? Is there something like that?
Yeah, so basically obesity is when people are, so obviously you have grades of obesity. You've got overweight, you've got obesity. So obesity is when you've got development and accumulation of fat that's going to start, that has the potential to cause health problems. And the World Health Organization defines obesity using the body mass index, which is based around your height and your weight. So the kind of global standards for obesity are a body mass index of above 30, but Asian populations have slightly lower body mass index for obesity. So I think it's about 27.5. If you go above that, then you're considered obese. And these are the levels where it's going to start causing problems with your health. But what you need to do is actually think about obesity as a scale rather than cutoffs. And if you're overweight, you should be trying to reduce your weight back to normal levels.
The reason we are talking about obesity is because it is linked to diabetes and to heart disease. So it's a context to start with. And I remember in our last conversation, we had said that it's not necessarily the physical look of somebody who may be large or overweight, but you can also have skinny fat. I think you had mentioned something like that.
Yeah, that's right. Yeah. So yeah.
So what is that? Can you share a bit about that? That you could actually look, not overly large, or overweight. You may be overweight, but the physical appearance may not be. But you could have visceral fat. I think you had mentioned. Like, could you share something about that?
So basically, so starting off, obesity. The problem with obesity is that you have a lot of fat, and fat is not just deposition under the skin. Fat is essentially an endocrine organ, and it influences the body and it influences the metabolism. And the accumulation of fat leads to resistance to insulin and reduced insulin production. And that leads to high glucose and a whole cascade of things, which leads to diabetes. But you can also have, rather than being overtly overweight and obese, people can get deposition of fat around their organs. It's kind of what we call visceral fat, when you've got fat around your organs. And that type of fat is even more diabetogenic. And so this is one of the reasons why the body mass index levels are lower in Asian populations, is because they have a higher propensity to develop this kind of fat around the organs, which in itself can increase their risk at lower levels of weight.
So that goes directly to our next slide, which is, a little bit more about how obesity is linked to diabetes. So you did mention insulin. So can you just share a bit more on that?
So it's quite complex, but basically, the more overweight you are, the higher your risk of diabetes. And it's driven by a number of different things. Fatty acids in the blood go up when you're overweight. You become resistant to the effects of insulin. What insulin does is it pushes glucose from the blood into the muscles and the body. And you become resistant to its effects. And then you start to actually lose or reduce the amount of insulin you produce. And what that does is the glucose rises in the body. But it's not just glucose. Diabetes is a disease which affects a lot of other things in addition to glucose. So it affects blood cholesterol. And all these things together, so when you get glucose and the cholesterol, all can affect the arteries in the long term. And in addition to bloods, so your glucose and cholesterol, it also pushes your blood pressure up. And these all kind of, over time, these can all affect the blood vessels in the body, which leads to not just heart disease, but it can cause problems with the kidneys, can lead to stroke. And so it's usually not just one problem, it's a whole syndrome of problems that are linked to being overweight.
So, just in simple terms, and maybe these are questions that, very, very simple for doctors, like I said, is anybody who has diabetes, suppose they have diabetes, would they have heart disease eventually?
It's not definite. So diabetes increases your risk of heart disease, but because you've got diabetes, it doesn't automatically mean you're going to get heart disease, but it increases your risk significantly. So if you are diabetic, there are a number of things you need to do. You need to make sure your diabetes is well controlled for a start by taking diabetes medications. You also need to try and make sure you're reducing your weight. You also have to look after your blood pressure, and you need to start looking at all the different side effects of diabetes. You need to get your eyes checked and your feet checked and all these kind of things. So you are at risk of heart disease. It doesn't mean you're definitely going to get it.
And does the reverse hold? Suppose you do have some heart-related symptoms, would you get diabetes?
Yeah, so certain heart conditions are related to diabetes. It's quite complex because when you have somebody who's overweight with high blood pressure, all these, they're all linked. So they all increase the chance of developing the other. There's a condition called heart failure, and people with heart failure are much more likely to get diabetes, and it's for a number of complex reasons. So, and within Singapore and Southeast Asia in particular, there's always this constellation of things that come together. So it's usually patients they become obese, they start to get high blood pressure, and they get high cholesterol. It's really, really common to have all these things together.
And can any of these things be genetic, one or the other, or all three, or is it just happens due to lifestyle choices?
So diabetes has got a genetic component. So if your parents have got diabetes, or you've got diabetes that runs in the family, you are slightly more at risk of getting diabetes. It's usually a combination. It's multifactorial, so it's partly lifestyle and partly genetic basis.
Okay, so in a nutshell, what I get is that obesity, diabetes, heart disease, they're all sort of linked. It's kind of complex, but it seems like the beginning is to maintain your weight, to have a stable weight to begin with.
The key thing is these are lifestyle diseases. So they're driven by bad lifestyle choices. So, and the things that lead to these diseases are not doing enough exercise, eating the wrong foods and becoming overweight, and maybe drinking too much sugary foods, smoking. So all these kind of lifestyle factors make your chance of getting all these diseases increased.
So during the COVID period, so let's just go into one of the things which are keeping all of us very active, food. Everybody is sort of fixated on food because we can't really do very much, so people are cooking, people are delivering foods. What foods are good for the heart? What should we avoid? What are we overdoing?
Yeah, so the key things for a healthy diet, I guess, is number one is kind of balanced diet. So what foods are good for the heart? So there are two diets that have been shown in trials to actually be good for the heart and reduce your risk of heart disease in the future. And one of them is called the Mediterranean style diet. And in a nutshell, it is basically a diet that's rich in fruits and vegetables and lean meats with some olive oil, and it's low in processed foods. There's another diet called the DASH diet, which has been shown in patients with high blood pressure to improve outcomes, and it's very similar to the Mediterranean diet. Again, it's lots of fruits and vegetables and lean meats. And I think the key thing, and I think the simplest thing for people to try and do, is to try and avoid too many kind of processed foods. And the problem is that when you eat out a lot, so you eat in restaurants or hawker centers, there's a tendency for these foods to contain lots of salt, lots of processed ingredients, and they often have lots of sugar and fat as well. So that's why they taste so good, because they've got all these kind of sugars and fats in them. And if you eat too many of these types of foods, you will overall affect your your cardiovascular health and increase your risk of obesity. I think everything in moderation.
Sorry.
Yeah, on you go.
You mentioned Mediterranean diet. Does that mean that people from that part of the world don't have or have less heart disease issues?
Yeah, there are certain parts of in the Mediterranean, like in Italy, where people have a lot less heart issues than other people, and that's where it came from. And it was these regions where they have these very fresh vegetables and unprocessed foods in their diets with olive oil.
So is there a general recommendation of, calorie intake? Is one kind of food calorie better than another kind of food calorie?
Yeah, I guess, so calories are just a rough quantification of the amount of energy in food, and women need slightly less calories than men. And the recommended daily calorie intake varies based on how active you are, and the more active you are, the more calories you'll need to sustain. There are lots of calculators online that will actually calculate how many calories and give you a rough idea of what calories you take in. But actually, the calories themselves are really, if you take the right amount of calories for your exercise levels, you will reduce your chance of getting overweight. But it's the nutritional balance of food that actually leads, I think, to how it affects your overall health. So it's having that balance of carbohydrates and proteins and nutrients in your food that's actually going to determine your health in the longer term. There are a couple other things that are quite important to avoid, and one of the things that we actually try and avoid, or tell people to try and avoid, is something called trans fats. And trans fats are often used, well, maybe not so much now because people are trying to eliminate them. They're often used in frying in restaurants, and they're a poor quality fat that actually does increase your cardiac risk. So you need to try and avoid trans fats in your foods, and they often come up under things like partially hydrogenated oils in the ingredients list, and they're particularly unhealthy. So definitely try and avoid those. And the other type of fat to avoid generally is saturated fats, and that's often the fats you have coming from animals. So and they're far more likely to increase your cholesterol.
So when you start treating somebody, and you obviously prescribe medication, and I'm sure you also walk through their nutrition with them, how does that change really happen in someone? Do they fight it? Is it hard for them to do that adjustment?
I think it's really hard. I think we all have probably gone on diets at some point, and it's incredibly difficult to suddenly change your diet. I think you need to do things, you make small changes incrementally. So let's just say if one of the things you do is you eat out for lunch every day from the hawker center, then perhaps you need to just start by making a simple change of maybe just eating out once per week or twice per week in the hawker center. And starting with these small incremental changes, if you try and change your diet completely, you're going to fail. So start by eliminating things, and perhaps asking yourself the question when you're making a food choice about whether you're going to eat something, just ask yourself, is it unhealthy? If you said if it's unhealthy, maybe don't eat it and try to make a healthier choice.
Sometimes people say that you get influenced by people you're living with, your family, right? If you don't have people around you who are also eating healthy, or if your cupboards are full of whatever chips and sugary things, and it's sort of hard to get into that zone. Do you give advice to whole families when you're treating a patient?
Well, yeah, often if you need to. So let's just say if somebody has a heart attack, if they never cook any of their own food, then you need to actually speak to the person that cooks the food in the household, to actually try and drive that change. So it does involve, it often will involve the family.
Now, during COVID, I mean, Singapore has pretty good supply chains and people can get their fruits and veggies, but there could be some people who don't have direct access, regular access to wet markets, etc. So they could be eating more processed boxed foods. Do you think that affects the state of their heart health?
I think during this period, if your diet is not quite so good for a couple of months, I think it's really not going to have much of an effect in the longer term. This is it's a difficult period. People are not going to be eating the same foods as they would normally. And if your diet has become a little bit more unhealthy recently, I wouldn't be overly concerned about it. It's just for a very short period. And things will change as the restrictions are starting to be relaxed.
Well, here's to healthy eating for everyone, not just people with, heart disease. I think all of us could do with
definitely
a reset in the way we are eating. And here's another topic which I found really interesting, and I think people do as well. The fact that men and women could experience heart disease differently. So the first basic, do men and women really have different symptoms?
So most men and women have the same symptoms. So most people that have, let's say you had a heart attack, most people will present with the same type of symptoms. They'll have chest pain with some tightness, some sweating, and breathlessness. Women are slightly more likely of having slightly different symptoms. So women are more likely to have breathlessness, the primary cause of the heart attack. So there is a slight difference in how genders experience heart attacks. One of the other drivers of this difference is that when people think of heart attacks and heart disease, they tend to think of men, and they think, well, women don't really get heart attacks and things like that. But actually, women do get heart attacks, and it's the number one killer in men and women. It's just that women tend to get cardiovascular disease and heart attacks when they're older. They tend to be protected by their estrogens prior to by their hormones prior to the menopause, and so what they tend to do is they'll get maybe heart disease or heart attacks 10 years later than men. So it's important that both men and women recognize that they can have heart attacks, and women should not, if they get, say, breathlessness or chest pain, should not just brush it off saying, I can't have a heart attack. They should consider themselves to be at risk and should get it seen to just like men should.
So in general, are you saying before women have menopause, there are more men getting heart attacks?
Yeah, so if you take the same age group, so if you take, let's say 40-year-old men and women, more men will have heart attacks than women. But women catch up as they get older. So when you get up into the 70s and 80s, you see more women having heart attacks. And they eventually catch up. It's just that they present later because they're protected before the menopause. And that doesn't mean that they can't have a heart attack before the menopause. It does happen, and I've seen it. So, I mean, the key thing is that it's important to recognize that both men and women get coronary disease and can have heart attacks, and that women need to be aware that if they are getting chest pain and breathlessness, they also need to get seen by a doctor and get assessed to make sure they've not got a heart condition.
So in your sort of practice, do you feel women tend to wait before they report, symptoms of discomfort? Do they delay it more than men? Yeah,
there's been some studies done that have shown that women do tend to delay a bit longer than men when it comes to the symptoms of a heart attack and reporting a possible heart attack. And the underlying cause of that might be because women think they've got less chance of having a heart attack. And so they maybe ignore the symptoms for longer than men do. So what this reminds us is that we all should be aware of what's happening to our bodies. And if there are any concerns, to get things dealt with quickly rather than delay.
So would you say, right in the beginning, we were talking about, health tests, etc. So you'd say this is applicable for men and women equally after a certain age, just doing some regular BP work or checkups are important?
Yeah, definitely. We all need to be looking at our lipids, our blood pressure, our glucose, and our risk factors for heart disease.
Okay. Is there any, overall advice that you feel that the world needs when it comes to monitoring one's heart health? I mean, there's a big trend going towards, self-care, being aware. What do you see over there? You know, when people taking control of their health, being more aware, what can we say? What kind of advice can you give?
So the scary thing is that it's estimated that 80% of all the cardiovascular disease, so that is heart attacks, angina, is completely preventable. So that is, what that's saying is that the things that these conditions that we get are driven by our lifestyles. They're driven by the fact that we don't exercise, that we smoke, that we tend to put on weight. You know, all these factors come together and cause these diseases. So if you actually start to address problems early on and start to make the correct lifestyle choices, you can fully prevent these type of diseases happening. And most of these heart attacks, you know, if we all led a very healthy lifestyle, the heart attack rate would drop dramatically to the point where they would be almost rare to happen. So we need to be looking at the cause, and the cause is the lifestyle decisions that we make. Start trying to make better lifestyle decisions earlier.
I find that staggering number. 80% can be prevented if people were aware and acted also, right? I mean, there's awareness and there's also incorporating that in your lifestyle.
Yeah, I mean, we all know it's difficult to change your lifestyle. It's difficult to change your lifestyle, but you know, simple things that are also difficult. So it's very easy for me to tell a patient, stop smoking. But that, for the patient, although it's a simple thing, stopping smoking, if you think about it, it's actually very difficult. But these are the decisions. If you make that decision and you stop, you will prevent or you will reduce your risk of having problems in the future.
Well, here's to us making these choices, sometimes hard choices, but really in the larger scheme of things, it seems like a no-brainer, right? I mean, we should be doing it.
Yeah, we should be, but...
So as a specialist with SpeeDoc, how can SpeeDoc help people with their heart health, you know, the different services or specialist consultations, especially now that people are more at home? We still want people to report how they're feeling and be aware of their symptoms. How do you think SpeeDoc can help?
So, I'm going to be working with SpeeDoc to carry out cardiology at home. So, and the services that we can offer are we can actually do ECGs at home, and we can do a simple ultrasound or echo scan of your heart if necessary. And we're also able to prescribe medications to deal with common conditions. So, in addition to that, blood tests can be taken, and these blood tests can then be dealt with in a lab within 24 hours. So there's a whole host of things that can be dealt with now at home. I think it's important though to remind patients that you know, if there are acute symptoms that you're worried about, then like an acute chest pain that you have concerns about, then you do need to consider getting dealt with very quickly. But there are lots of things that we can do to help patients at home.
And in just general, you know, the trend of healthcare where you can have healthcare at home, how do you see this really happen? Like, how do you see it evolving over the next few years? COVID has, of course, brought it to the fore, where people are using telemedicine a lot, and SpeeDoc has been helping people. How do you see this evolving?
Yeah, I think so. There are certain conditions that can be dealt with very well using telemedicine, and often it's more chronic conditions. So let's just say if you've got high cholesterol, and you don't always need to come in and see your doctor. There are certain other conditions that do need to be seen by a doctor and not have to be seen in person. How I see things evolving, I think we're going to see more teleconsults happening in the future. I also think we're going to start to see more home monitoring options. So I know we all use fitness trackers and things now, but the future of these things is having, you know, blood pressure and heart rate that integrates online. So your data is already available online with your consultant. So you will see an increase in the telemedicine type services. And I think there's going to be more integration of data. But there will also still be a place for people to actually come in and see their doctor, particularly if they're new patients, because they need to get fully assessed at the beginning of their healthcare journey.
I think it's very interesting times for our health setups where people can start learning more about their own health, try and prevent things, like you said, can be easily prevented, have access to health at home while having doctors, doctor visits coexist at the same time. So Thank you for all the sort of questions I've asked you. Some may have been really simple, but the idea was to really break it down into layman's terms, really. I'm going to now stop sharing the screen because we're going to go into our Q&A session. And I'm going to find some Q&As, questions. So I have a question from Jeffrey, who says, I have reflux and hypertension, and one time I had breathlessness and slight discomfort above my left chest. I admitted myself the first time and found I didn't have a heart attack. When the second time it happened, I just took my usual meds, Gaviscon, and I was fine half an hour later. Should I not take the risk the next time it happens? So
I think, first of all, I have to say that I cannot comment on individual kind of cases because I cannot give advice to a group like this. In general, what I will say is that I guess it comes down to you. Sometimes, let's just say you have a chest pain and you know it's reflux or it's a muscle pain. You don't need to see somebody. But if you have got any doubts and if you have anything that you are really worried about, you should definitely consult. And even in patients that have reflux, even in patients that have known reflux, if there's something new and different about that and they're concerned that it's something else, you should get seen by a doctor and should get it assessed. And you should never delay and never worry that someone's going to say to you, oh, why are you bothering me? Because, we're here to help. We're here to help people. And we would never say to a patient, look, why are you wasting my time with this? If you have concerns, always get assessed.
Okay, I have another question. Again, it's an individual case, but it's kind of linked to nutrition. Somebody is saying that their father is 92 and has heart disease, which is managed by medication. Now, the doctors recommend drinking skimmed or low-fat milk, and some say drink full cream milk. So this is a milk question because father is vegetarian and needs protein. Is there a link to protein and heart disease?
So I think with the full cream milk thing is protein, there's lots of protein in milk. There's also saturated fat in full cream milk. And I think doctors that are recommending drinking skimmed or low-fat milk are trying to reduce the saturated fat intake. Saturated fat has a tendency to put up your cholesterol. However, what I will say is when someone's 92, they have very different health concerns to someone in their 40s or 50s. In your 40s or 50s, you're worried about preventing disease. The long-term problems of having cholesterol and blood pressure are developing heart attacks and strokes. As you get to the age of 92, your healthcare goals change. You're not really overly trying to prevent long-term disease because your life, you're only going to live maybe another 10 years at most. So you're not really trying to have the same targets as you do in your 40s and 50s. So if you're assessing whether a 92-year-old should get full cream milk or not, you have to look at their overall diet. So if they are vegetarian, perhaps they're not got very good intake of calories because they're not eating so much, then yes, full cream milk is totally appropriate because you're trying to get calories into them as well. And this kind of highlights why, it's never a one-size-fits-all approach to nutrition. It depends on the person, what their overall diet is, and what their goals are, what their health goals are.
Okay, my God, if I was 90 plus, I wouldn't even imagine the kind of nutrition needs I would have.
Yeah,
wow.
Exactly.
Wow. There's another question from a lady whose mother had a heart bypass about 8 years back, and apparently she's taking 11 pills daily. Wow. And that seemed to have affected her palate, and she has no interest in food. Our guest is concerned about her nutrition and how you would go about helping to balance nutrition.
Yeah, that's tricky. So, yeah, 11 pills daily is quite a lot. And you often find that elderly people tend to end up on quite a lot of tablets. Just before I move on to nutrition, when it comes to elderly people, it's quite important to actually sometimes take a step back and have a look at the tablets that they're taking and decide which ones are important, which ones aren't. Because when you're on a lot of tablets, there can be some interactions and side effects, particularly in elderly populations. So, and you can often find yourself in a situation where you give one tablet, which causes a side effect, and then you give another tablet to deal with the side effect. But actually, the correct thing to do is reduce the tablets a little bit. So again, you have to take a holistic approach. First of all, looking at why there's no interest in food. So is it the tablets that are causing it, or is it something else? Is there some other underlying condition that's causing them not to eat? And it's important that you see a doctor to exclude serious conditions. In terms of nutrition, this is when it comes to a nutritionist is very important to see, or a dietitian. They can actually, first of all, assess how much food they're able to take in and if they require supplementation. It's very difficult to comment on because some people will have a very healthy appetite, some people will only be able to be taking, you know, a few sips here and there. And the type of nutrition you recommend is going to very much depend on the person and what volume they're able to eat. So I would recommend actually seeing a dietitian or a nutritionist in that case.
I have a few cholesterol related questions.
Sure.
So we're being told about, you know, even at a young age, people have high cholesterol or borderline cholesterol. What is the approach? I mean, do they need to go on medication, or is it lifestyle choices? You know, whether you're in your 40s or 50s, when people are nervous about starting medication, what should they do?
Okay, so I'll run you through what we do. So as cardiologists, the way we determine if somebody needs treatment, okay, first of all, you have to start about why we treat. So when people have high cholesterol or high blood pressure, it leads to heart attacks and strokes in the future. So when we see a person, we try and work out their risk of heart attacks and strokes. If they're very low risk, then you often don't need to give them medication because they're already low risk. What we're trying to do is modify that risk with medication. So the first thing we do is assess someone's risk, and risk of heart attack and stroke is driven by age, cholesterol, blood pressure, smoking. So you assess their whole global cardiovascular risk, the risk of heart attack and stroke over the course of their life for 10 years. And if they fall into a risk group that we think would be benefit from treatment, at that point we would offer treatment. So the first step is actually assessing risk. And sometimes young people or who have a borderline cholesterol are actually very, very low risk of problems. So we don't recommend lifelong treatment. So it's very individualized, and that's why you need to see a doctor to assess your risk before you consider starting treatment.
I don't have too much time for too many questions, but maybe one or two last ones. And if people have other questions, you could write into us, contact@SpeedDoc, and we'll try and get some answers to you. There is one which is around working out and exercising. So gentleman says that he used to run 20 kilometers weekly till he had a heart attack. And after the heart attack, he couldn't work out as regularly. And now his weight is increasing. So it's a difficult situation. He was obviously very active, still had a heart attack, now can't continue with that, and his weight is increasing. How does one balance this?
Okay, so I think the first thing, so if you've had a heart attack before, the first thing you need to do is work out why you're not exercising as much. Is there heart damage? So the first thing is actually to see your cardiologist and have an assessment of your heart. People with heart attacks can be left with no damage, but people with heart attacks can also be left with severe damage, which reduces their ability to exercise. In general terms, after a heart attack, we always recommend people gradually get back to exercising. And we know that the more you exercise, the more you will do better in the longer term. What we also offer people after heart attacks these days is cardiac rehabilitation programs. And that's when you see a specialist physiotherapist who will guide you through supervised exercise. And it has a number of bonus effects. So when somebody supervises you exercising, after you've had a heart attack, you're often very worried about getting back to the levels of fitness you had before. If someone's there to supervise you and educate you, it gives you the confidence to start exercising again. So I would think that the two most important things are, first of all, to make sure that you haven't got heart failure or have problems with the heart. And number two, consider getting advice on how to get back into exercising appropriately from your cardiologist or from a cardiac rehab specialist physiotherapist.
So I have another question related to trackers. These are gadgets that we have now, which are tracking all kinds of devices.
Yeah.
I'm wearing one right now. So some of them, are they useful for you as a doctor when people come and say, I'm monitoring my heart health? Does this, and especially ones which have EKG, do you use that?
They are useful. So I guess anecdotally, there's two things. The first thing is when patients notice on their heart rate, they have sudden jumps in heart rate. Often that can point towards an arrhythmia happening when they've suddenly become very, very fast heart rate. And so it points towards an arrhythmia, and then you can do more investigations. And the second thing is the Apple Watch in particular has got a special feature which has been shown in clinical trials to pick up something called atrial fibrillation. And it does work, and it's very sensitive at picking up atrial fibrillation. So yeah, they are of benefit. And actually, I think we're going to see this evolving over the next 5-10 years. What I will say is they don't pick up heart attacks. So you can't rely on these fitness trackers to pick up you having a heart attack. All they do is largely look at the heart rate and rhythm. But yeah, they're useful. I think I encourage them. I think it's useful for people to see how much exercise they're doing. If I look at my fitness tracker and see I've only done 200 steps that day, I'll consider going out for a walk or something to try and build up my activity. So yeah, I think they're definitely worthwhile.
I have another one on congenital heart disease. Does it increase the risk of acquired coronary heart disease? And is this an area you consulting?
That's quite a broad question. So congenital heart disease is basically any heart condition that you're born with. And it can vary from being very, very minor congenital heart disease to being very, very complex, where children need incredibly complex operations when they're younger. I am not a congenital heart disease physician. I will see follow-up cases, and I will manage people that are so-called adults with congenital heart disease. But there are often, because some of these conditions are incredibly rare, the more severe forms of it will often be seen at specialist centres where, because it's a rare condition, it's useful to have all the patients being managed in the same place. And does it increase your chance of developing other heart disease? Again, it very much depends on the condition. And there are so many variants of congenital heart disease, it's very difficult to comment.
And a last one, and then we're going to wrap up. Somebody has hiatus hernia and so faces acid reflux, chest burns after meals. Is this anything related to heart disease? What should they do?
So if you've got a hiatus hernia, I would definitely see a gastroenterologist. They will help you. So acid reflux can be incredibly unsettling and very unpleasant, but there are medications that you can take. There are lifestyle things that you can do. You can reduce meal size. You can try and eat earlier and not go to bed on a full stomach. These will reduce your symptoms. But definitely I would start off, it's not really related to the heart. Sometimes kind of hiatus hernia or reflux type pain people can think that's reflux when actually it's a heart problem. But the primary port of call should be a gastroenterologist for your hiatus hernia.
Well, I think thank you so much for being with us for this webinar, for answering all these questions. It's like you said, it's a big, complex area. And I think the more we can help people understand, get it across to them, and have doctors like yourself accessible in forums like this, I think it'll really go a long way in just educating people, and getting them. I still can't wrap around my head around this 80% can be solved for.
It's amazing, actually, that so much disease is preventable.
Yeah. Well, thank you so much for being with us today. Thank you to all our guests. I hope you found the session informative. And I'm just going to share my screen again. So yes, if you have any further questions, please write in to contact@speedoc.com, and we'll try and get some answers to you if we can. And if you haven't downloaded our app as yet, please do so. I mean, your doctor is literally in your pocket in the app, so it's useful to have. Thank you again, everyone. I hope we'll see you next time as well. And if you have ideas for new webinars, topics, do write in to us, and we'll try and arrange those as well. I'm going to end the session now. Have a great week. Be safe, be healthy, take care.
Thank you. Thanks for everyone for joining us.